Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking with board-certified interventional cardiologist B. Ramesh Reddy about heart attack survival. Dr. Reddy, we've talked about heart attacks. I want to know, why is time so important in the treatment?
You know, time is muscle, Barb. Let's take a look at the pictures and then we'll talk. This is a picture of the heart with the two arteries, one on the left and one on the right. We typically have these three arteries, one in the back, front and right, that supply the blood flow to the heart muscle. Whenever any of these get blocked, like we have here a fatty buildup in the artery, that will reduce the rate of flow and causes an impediment to the blood flow to the heart muscle. And finally, when there is a complete blockage, we will see that a heart attack occurs. So this is the clot that is stopping the blood flow. So that in effect is really the heart attack. So it is important to open up this artery and re-establish the blood flow. So the sooner we do it, more heart muscle we save, we reduce the size of the heart attack and better function for the patient. So that's why time is muscle.
Because if muscle is damaged on the heart, that can't regenerate heart muscle?
Unfortunately, heart and brain do not regenerate. The other organs like liver, for example, can regenerate in a hurry. So this is a very precious heart muscle. So it's important to limit the time the damage is occurring.
What happens then when the patient comes to the emergency center?
Typically, let's take a step back. Let's say a 911 call goes up. EMS visits the site of the patient immediately. On the field, they have the capacity to do a EKG right off the bat and transmit the EKG to the emergency room physician. So on the EKG and listening to the symptoms, we make a diagnosis that this is a heart attack indeed. At that time, the cardiac cath team is immediately alerted that if I am on call as an interventional cardiologist, I receive the phone call, the cardiologist on call gets it, then the entire team is immediately mobilized, sometimes even before the patient hits the hospital. And once the patient is in the hospital, they get immediately another EKG, get his vitals, put an IV in, and is immediately transported to the cardiac cath lab, where we begin the process of taking a picture to identify where is the blockage, and once we find the blockage, we open it up.
Well, what are treatment options then? Does everybody go to the cath lab and have a stent?
Anyone who comes in with a heart attack, which we call as a ST elevation heart attack, when we diagnose that there is a blockage, just like I showed you the picture, a clot that blocks the blood flow, all of them should go to the cath lab. That is the recommendation. And typically once we are in the lab, I think I can show you an example, hopefully. This is a blocked artery. No blood is flowing through that. Now you will see that there is a wire that is trying to get across the blockage, slowly channel itself into the artery, beyond the blockage, and then the wire is now going all the way down. And over the wire, you will see that there's a stent being deployed, and now the artery is open.
My goodness.
So basically what you saw is a blocked artery is visualized, a wire is passed through, a balloon is there to open up the artery, a stent is deployed, blood flow is re-established, and we save the heart muscle.
That's amazing. And that is a stent?
It is almost like a scaffolding. You open up the artery and you put this metal scaffolding inside the artery to prevent it from closing down, and the flow of the blood keeps the artery open pretty much. That's the mechanics of it.
So it's immediate filling of the blood to the heart.
It is. In fact, the success of the procedure is determined almost immediately. The relief of symptoms is immediately. EKG response is immediately. It is very gratifying for the patient as well as for the physician.
Absolutely. What times are you shooting for from the time the patient hits the door to the time they're in the cath lab?
Actually, we have the expected time is from the time patient hits the hospital emergency room till the opening of the artery to be 90 minutes. But we are well under 60 minutes right now.
Really?
So that's really important. The sooner we open up the artery, the better it is. So our times have been very efficient, and I think that's a testament to how good the teamwork happens. The EMS personnel, the emergency room physicians, the cardiologists, and the cath lab team. All of this works in such a smooth sequence that the end result is very, very good.
So are the outcomes, with times that low, are the outcomes better globally for the patients that you see, or does it depend on so many other factors?
There are other factors, but just by improving this factor of timeliness and opening up the artery quickly has made a tremendous impact on reducing the size of the heart attack and improved outcomes.
And the patient's recovery is dependent on how much damage they had before?
Well, the recovery, let's assume a patient never had a damage,
Okay.
comes in for the first time for a heart attack. If you can almost abort a heart attack if you can do this within 30
Wow.
minutes.
Amazing.
So the damage almost will be non-existent. Now, for those who have already had a previous damage, any additional damage is so important and it's so precious myocardium, heart muscle that is left over, so you want to preserve it even more. So basically, time is muscle, and that's what we strive to do here, save that heart muscle.
Very interesting, very hopeful. Any closing comments?
Well, all I can tell you is if you have any of the risk factors, try to talk to your doctor and try to address each of the risk factors: high blood pressure, smoking, high cholesterol. And you can't do much about the family history, but you can address the others. Now, if you're having a heart attack, call 911, immediately go to the emergency room and let the cardiac cath team and the ER team take over. That's the best thing we could do.
Thank you so much for joining us.
You're welcome.
Stay with us. We'll be right back for more information.